Hi, everyone. My name is Heather Atkinson. I'm a physical therapist at the Children's Hospital of Philadelphia. I've been at CHOP for almost 25 years now, and I love working in the Leukodystrophy Center for Excellence. So, physical therapists, what do we do? We are movement experts who work to improve the quality of life through prescribed exercise, hands on care, and patient education. As you probably know, you can find us in lots of different places. We work in early intervention and in schools. We work in outpatient therapy and, of course, also in our leukodystrophy clinic. In early intervention, we can come into your natural environment to help your child with their gross motor skills, ages 0 to 3, and then from 3 to 5 in the intermediate unit, and then through school. And early intervention is really great because children really learn best in their home natural environments. And so PT is really designed to stay with you through that to work on your goals. Outpatient therapy, you may want to pursue if you have a need for an additional amount of therapy to work on some specific goals, or if you want to try out some different equipment. Outpatient PT can be a nice addition for a short while. And then in clinic, we really love to see you on, a fairly regular basis to try to help out with your home program, maybe updating exercises or splints or equipment needs, or maybe even making those suggestions to change frequency of early intervention or outpatient care. We have found that, and you probably know this best, that you might get everything sort of just right with your therapy program and splints and equipment, and then your child goes through a growth spurt, and all of a sudden things aren't working quite right anymore. So that's really what we're here for, and we want to continue to follow with for you. And then finally, I do get a lot of questions on what to look for in a PT or a PT center. And I think that first and foremost, you want to make sure you have a pediatric physical therapist or center so that they have the right size equipment and they know how to motivate your child. And also, you want to make sure that they provide one on one therapy and never a group setting because I think your child should have that one on one attention. And then if you can find a PT who has their board certified specialty in either pediatrics PT or neurologic PT, that's great, but not necessary. So, mobility for children with AGS, why is it important and what might it look like? So, mobility, it helps your child feel good. It might help them engage more with the environment or with you or with the teacher. It might help them explore. And what might it look like? It could be something as simple as, sitting properly and in good posture with good support and stability in an activity chair so that they can engage in some type of experience with you or in some type of learning with their teacher. Or it could be something even more apparent, such as rolling or transitions or walking. So, in setting up goals, we always start with what are the child's strengths and what are they able to do? And then we think about what do we want to work towards and what can we as PTs and the family and the rest of the team do to help make that happen. So, for intervention or treatment, first we will collaborate with the interdisciplinary team. We want to think about all the different pieces of the child and the different types of medical interventions that can occur. So, we think about their pulmonary system, their nutrition, their spasticity and tone, and there's so many different specialists in your child's team. So, we work closely with them and think about how these different aspects can help or hinder a child's mobility, and so we will work with the team with that. We work to decrease any secondary complications that can occur from having a neurologic type condition. So some children can have problems with skin integrity from challenges with positioning. We want to keep a watch on that. Some children can have problems with contracture when the muscles get so tight you can't stretch them out anymore. Some children have problems with pain. We want to avoid that if we can at all costs. And we also think about bone health and bone density and wanting to help preserve that for as long as possible. PTs also work with creating capacity for your child to reach those goals. So I think about this as the building blocks in order to reach the goals. So, what is the optimal position for your child to be in order to try to make a movement? What range of motion might they need in order to do that? So, for example, if we want your child to be in a stander, we want to make sure that their knees and hips and ankles have a good amount of range of motion in them so that they can do that with comfort. There's lots of equipment out there that can be helpful to aid in your child's movement. And this is a good place to talk about if you have an equipment clinic near you at a hospital type setting, they're really the best places to do an equipment evaluation because the amount of equipment that comes out is always changing. And so the therapists that work there work closely with vendors and oftentimes can get samples so you can actually try them out with your child and see what might work best before you order. And then finally, we know that, a child isn't like an adult and they're not going to just move if you tell them to move. We want to set up the environment to be motivating and we want to, try to encourage them to have that initiation of movement from within. And so we work a lot with that. Here are some examples of common types of equipment that we might order. The stander that up in the left-hand corner is the Lecky supine stander. We also talk a lot about gait trainers. There's the Riften on the right, the red one, and then the yellow one is from ETAC. They have devices called a Mustang or a Pony or a Crocodile. So there's a lot of different types of devices out there. It really all depends on what's going to work best for your child at a particular moment in time. There's also wheelchairs and strollers and activity chairs and comfort chairs, and Stacy Cusack, our occupational therapist, is going to go into more detail with those. These are some common orthotics that we might recommend. The one on the left are the AFOs that we might recommend for positioning in a wheelchair or standing or walking. And the one on the right is a stretching splint to wear at nighttime. And if you think about anyone who sleeps overnight for a period of about 8 hours or so, or however long you sleep with your toes pointed down. So it has the tendency to stiffen up or maybe tighten the muscle in the back of your ankle, especially if you have some increased tone back there. So if you sleep with a device like this on, it really helps stretch you out if you have that tendency to get tight so that when you are ready for your day, you're not stiffened up. These are some common postural support systems that we recommend in our clinic. The one on the far left is called a Theratog Dragonfly. This has got a hard shell on it, and it's really, I think, best for kids that are just working on their sitting skills. It gives a lot of support. The one in the middle is called a Spio Expedition. It's made of Lycra and it has like a good stretchy compression to it. So children have some good sensory input to their chest and back. And then it's got that cross X that's removable and it can give a little bit more postural support. And then the one on the far right is called a DMO suit. And this is another great device. It's custom made. It's made of that stretchy Lycra fabric so that you really get some good sensory input. And then those little black pieces, those are custom panels that are sewn into the Lycra DMO suit that give a little extra pull where the muscles need a little extra facilitation to sort of activate when you're doing movement. So that can be a really good option as well. And then finally, physical therapists, we really are thinking about that mobility all the time, and we want to do whatever we can to help you and your child with their mobility goals. And a big part of that for kids with AGS is thinking about what is the best alignment or position to help draw out that movement. We want to put, maybe we want to put the limb in a gravity eliminated plane so they don't have to work against gravity. Maybe if they put the arm up a little bit, it's easier to flex the elbow. There are different things that we can try. And this picture down here below is just like a little visual example. The picture on the left shows this little girl and she looks unstable. Her back is curved. She looks like she's, working and using her abdominals to try to hold herself up. Her feet look unstable. And then just with a quick little alignment and positioning device, you can see how much more stable she looks and how straight her back is. And she looks like maybe she's a little bit more ready now to either work with movement with her arms or her legs, or maybe engage in a task with a caregiver or teacher. We also, think a lot about what's beyond physical therapy, and we want to help you with finding activities in the community that could be fun for your child and for you, thinking about aquatics or hippotherapy, horseback riding therapy, maybe even karate or yoga. And we love trying to find some of those resources for you out in the community if possible. And, finally, with clinic, we will see you on a periodic basis, and we are always here to assist as needed. And I wanted to mention that, the COVID-19 pandemic, if nothing else, it certainly helped us learn how to use technology in a hurry. And just recently, I had a great Zoom call with a PT out in Michigan who was following a child who was in our clinic, and she wasn't quite sure how to set up a gait trainer and all the little tinkering and modifications to set it just right so that this child could be in the best position to take steps. And so we just did a Zoom FaceTime call, and I pulled out my gait trainer and she had her gait trainer, and we were tinkering and discussing that and trying that out. So we are more than happy to do that anytime. So please just reach out if you feel like that would be something that could benefit you. And then finally, physical therapy is involved with the research team at looking at the best tests to measure function in children with AGS. They're looking at the most reliable and most sensitive tests to pick up the smallest effects of treatment so that your child can have the best assessment possible. And then finally, this is my contact information, my phone number, and my email address. And please reach out if you have any questions at all. Thank you.